thank you guys all for being here on your weekend to learn about autism. We wanted to do this presentation just because I'm always blown away by how many of you guys go into the healthcare field and become doctors and SLPs and OTs and all those great professions. And it's exciting. And I happened to, when I was in university, do a big project on healthcare access. So I thought you guys would be a good audience to share it with. And it's also a nice time to do this because April is Autism Acceptance Month. So it's a nice time to be thinking about we continue to make our society more inclusive. So I'm going to talk a little bit about healthcare access, and then Neha's going to talk more generally about workplace experience. So what we're going to do today is we'll go over the medical and social model of why we need to talk about healthcare access for autistic adults, what some of the barriers are, what maybe some solutions could be, and then for any of you going into SLP, what the SLP's role is in kind of providing. So, and throughout the presentation, I'm gonna try to get you guys to be a little interactive. I've got lots of questions, so feel free to just turn on your microphone and answer, and also feel free to just pop something in the chat, because I want this to be a little bit of more discussion than just me talking at you guys. So first off, I just want to talk about the word disability, because I think that it's kind of misunderstood in our society still, that disability is a bad thing. Sometimes I think people think. So we hear people using terms like differently abled or special abilities, and these kind of fluffy terms that actually aren't that helpful. So disability should be a neutral term. It shouldn't be a bad thing. It shouldn't be a bad word to use. And so there's nothing wrong with referring to autism as a disability or as a disorder, because it kind of reinforces the fact that having a disability is nothing to be ashamed of. And there's a few different ways that we can look at what disability is. So the main way that I think we grew up knowing, and that is often still what's talked about in university settings and healthcare settings, is this medical model of disability. And that's the idea that what is disabling about having a condition is inherent to the person. So say you're in a wheelchair, you are disabled because you can't walk up the stairs, and that's why the world is inaccessible to you, because you can't get up the stairs. But the other way of looking at disability, which is preferred by most of the autistic community, is this social model of disability. And that's to say that it's not inherent to the person that there's something wrong with them. It's more that the society and the environment is what is limiting in participation. So for the example of a person in a wheelchair, the social model of disability would say, there's nothing wrong with the person, stairs are inaccessible, and the world is not equally accessible to them. And so that's what's kind of led to them having a difficulty participating. So if you have ramps and you have elevators and you don't have curbs on the roads, then the world is equally accessible. And so this is kind of a really obvious physical example of a social barrier, but it extends to barriers in attitudes, barriers in environment and inclusion that go beyond physical things. So if you're going into medicine, or if you're going into any healthcare profession, just keep this social model in mind, because it's likely that you're going to hear a lot about the medical model, but there is a different way of looking at things. Okay, so into more specifically healthcare access. So it's a really important topic to talk about, because autistic adults are at a greater risk of having physical and mental health conditions than their neurotypical peers. And also right now, generally physicians don't feel like they have the knowledge or the confidence to treat their autistic patients. And research has identified lots of barriers to equitable healthcare access for autistic adults. So it's an important thing to talk about. So what's the risk? Well, this is surprising if you haven't heard it before, but some studies have found that autistic adults do have a shorter life expectancy than non-autistic adults. And it's not fully understood yet, but literature reviews have found that that autistic adults are at risk, a greater risk for lots of different healthcare than different health conditions than non-autistic adults. So cardiovascular risk factors is a big one. And these are all the different conditions that they might be greater risk for. So immune conditions, sleep disorders, gastrointestinal disorders, and many, many more. So it's really important, not just because we want to provide equitable care for everybody, but also because potentially autistic adults have a greater need for really high quality health care. And it's really important that they have equal access to that. But right now, physicians and clinicians don't have the sufficient knowledge to do that. So a large-scale study, and I just quote one or two studies because there hasn't been a ton of research on it yet, but this study looked at what do all these different healthcare professionals know about autism and how confident they feel in providing good service to their autistic patients. And 70% of them are rating their skills as poor to fair. Many people say they didn't have enough education during their training and residency. A third of the providers in this study said they just provide their usual care with no accommodations. We're going to see later in the presentation why that's not necessarily the best. And then other people are saying that they're adapting their care kind of in the wrong way. So they're avoiding talking about certain topics with their autistic patients, just probably because of bias. And then 70% of them, of the physicians in the study said there really is a need for training on effective communication strategies. So if you are more on the SLP side of things, that's interesting to you because we can probably help with providing that training. And then also more than half identified a need for improving the transition between pediatrics and adult medicine. And that's a really common theme in autism research, even outside of healthcare, that transition period where you're going from being 17 to 18, 19, 20 is a really important time where we start to see a lot of barriers and where we see a big drop in services and supports. So support in secondary education, support in finding work, support in healthcare access. It's something that needs a lot of attention. So another study that was done in the UK looked at kind of the difference between what physicians knew about autism and what they knew about treating autistic patients. So in this study, they found that actually most of the physicians really had a good knowledge of what autism was. They knew about autism, they were aware of it, but yet they were only somewhat confident in treating their autistic patients. And so this really shows us that it's not enough to just increase awareness about autism. You have to teach people what to do. And it's kind of really relevant right now because going into April, sometimes you'll hear April referred to as Autism Awareness Month, and sometimes you'll hear it referred to as Autism Acceptance. And that Acceptance Month is kind of a movement that's being kind of pushed for by the autistic community because they're saying that, you know, most people know what autism is. Like, we don't really have an issue with being aware that autism is a thing. A lot of people have heard of it. There's just no acceptance yet. And there's all these kind of misconceptions about it. And this is similar. We don't just need to train people on what autism is. We need to train people actually, what do you do with that knowledge? How do you treat your autistic patients well? All right, so does anybody have any thoughts? Has anybody had any experiences already in school where they feel like they're not getting enough education on autism? Or is it surprising to anybody?
No question, Annika.
Yeah.
What I apologize if I missed this, but what percentage of the population is on the autism spectrum disorder? Just because I know that a lot of doctors don't have the training in it, but how niche of a population is this to get the specific training to interact with this population?
there's a new, so it used to be 1 in 54. Now the new CDC norm says 1 in 44. So it's about 2.5% of the population. And it's probably even higher than that because a lot of girls go unidentified and a lot of people go unidentified. So it's common. It's more common than people think it is.
Oh, good to know. Thank you.
Any other thoughts on autism? So every single doctor is going to have an autistic patient. It's not some once in a while you're going to get a patient with autism. You're going to have a lot of autistic patients, no matter, and you're going to have a lot of autistic probably coworkers, no matter where you end up.
Yeah, those stats don't surprise me at all, Annika. Just coming up to finishing my first year of med school, very, very little, if any, training or even mention of people on the spectrum. So it's unfortunate.
Yeah. So hopefully I get the sense that that's changing. So I hope that in the next few years that this is going to be more commonly talked about. But right now, yeah, it's really not. So let's talk about barriers. So kind of for this, there's so many barriers for autistic people. Systemic barriers, but what I'm really going to focus on are what are the barriers that you as one single person could really address in your workplace or in your practice as a healthcare professional. What can we deal with kind of at an individual level? So I'm going to ask you to brainstorm again, and you can just put it in the chat if you don't want to turn on your mic. What do you think some of the barriers to equal healthcare access are? You can think about chatter kids and what you know about autism from chatter.
Sorry, just to clarify, the barriers for those with autism accessing healthcare or those providing
having equal access to quality healthcare, I'll say. So sensory sensitivity, that's a great idea. Service in different languages, that's a great idea too. I think both of those are right. Ideas. All right, well, I'll tell you. So one of the biggest barriers is planning and organization barriers. So I think this is something that executive functioning is something we work a lot on in chatter because it has a huge impact on your adult life. So barriers to having equal healthcare access include maybe the autistic patients have difficulty with making appointments in advance, difficulty following through with their doctor's recommendations, difficulty prioritizing their healthcare issues. So one study had a report of a patient that they needed to go to the hospital and they knew it, but they also needed to be at home to water their plants. And they had a hard time prioritizing which one of these was more important. So it takes some education. Forgetting appointments, going at the wrong time, having difficulty assessing whether their symptoms require a visit to the doctors, difficulty with implementing the lifestyle changes that their doctors recommend, and difficulty translating medical advice, kind of generic advice, into a concrete plan and concrete steps. So for anyone who maybe has taken some psychology, taken some courses in university, what do you think the source of this planning and organization difficulty is at a cognitive level? What's that called? Said it earlier. Is executive functioning. So this is huge. Somebody just said it, perfect. Executive functioning is a big barrier to a lot of things in adult life. And this other one is the difficulty assessing whether a symptom requires medical attention can be differences in interoception. So this is maybe something you haven't heard about as much because it's not as widely talked about, but autistic people often have difficulty with interoception, which is kind of knowing your internal physical state. So that's why we see autistic people maybe having differences in their pain perception. Maybe they feel pain more exaggerated than a neurotypical person does. Maybe they don't really feel pain or feel cold or hot temperatures as much. And that's also why we see our kids in chat are having difficulty with understanding their own emotions, because there is a language component to that as well. But another component that we see when someone can't recognize when they're feeling frustrated, they can't recognize when they're starting to get escalated, is because maybe they're having trouble picking up on those subtle physiological responses to an emotion. So that's something that is really important to know as a physician, that how your patients describe pain might be different than your neurotypical patients. So another barrier that someone said in the chat that you're exactly right is sensory barriers. So waiting rooms are kind of sensory nightmares. There's noise, light, smell. Super stressful. There's crying people, there's people that are stressed, there's people that are angry, everyone's close together. So especially in an emergency room setting, it's really overwhelming. And then the other sensory barriers are just in the actual physical exam. So getting blood work can be a huge barrier, and someone, it might just be so distressing that they just don't get their blood work done. Being touched unannounced leads to discomfort. Not fully understanding what the context and the consequences of an exam, a physical exam could be. So if someone says, I'm just going to test your reflexes, I'm just going to check your blood pressure, and put this blood pressure cuff on, and you don't know that it's going to start getting tighter and tighter, somebody didn't warn you for that, well then suddenly you're taken kind of by surprise, and you might have a big reaction to it. So this is something that might be a reason why an autistic person would just avoid getting services, because these really are a big deal. And then another barrier is communication barriers, which somebody else said in the chat too. So difficulty using the phone to book appointments, difficulty feeling understood by the provider, communicating with doctor and reception staff is hard. For a lot of autistic people, sensory issues or being in a crisis really exacerbates communication difficulties. So there are people that are perfectly verbal, they can speak, don't have any language difficulty when they're in a calm state in a calm environment. And then they might kind of become non-speaking in times of kind of overwhelm or times of meltdowns where they just can't access their verbal language in that moment. So there are people that AAC, using an AAC device is not an all or nothing. There's some people that might require some picture support, require some AAC system some of the time, and that can be something that you might have available in your clinical setting. Processing is a really big issue. And so I know it's a big issue, especially, well, for any doctor, but especially family doctors. Appointments are fast. They have so many patients to see, and appointments are maybe shorter than we'd like them to be. But it's worth considering if it's possible that maybe your autistic patient gets double the time in an appointment than a neurotypical patient, to allow for processing time, so they don't feel rushed, allow to help them to follow directions. Another thing that's, I think a lot of healthcare professionals are taught to ask open-ended questions, because for neurotypical communicators, open-ended questions leads people to kind of tell more. And if you just stay silent, people keep talking, and then they give you all the information that you need to hear. So it's a great strategy when you're talking to a neurotypical person, but for an autistic person, this actually is maybe going to cause stress and maybe cause them to leave out and forget information that was important to share. So it's worth considering using just close-ended question, or giving them options to choose from and changing their interview style a little bit. And then literally interpreting language can be hard too. So a term like, is it a sharp pain? Well, what does sharp pain mean if you don't understand figurative language? Or can you rate your pain on a scale of 1 to 10? Someone who interprets things very literally might not be able to make sense of that. And then another thing is just leaving out essential information if they're not directly asked it. So what's some of the possible solutions, what could be some of the possible solutions to all these barriers? If you were going to have your own practice, see your own autistic clients, maybe think of someone from Chatter that might come to you as a healthcare provider, what would you do to accommodate them?
I think one simple thing that if you take a look at your day schedule in advance and recognize that a patient that's coming in might be on the spectrum, maybe just setting aside a little bit of extra appointment time to make sure that they don't feel rushed and you have some more time to maybe address some of those communication barriers.
Yeah, that's huge. Someone said, yeah, having a box of suggestions in the waiting room to accommodate for different preferences in the physical environment. That's a great idea. Another thing that we kind of started doing during COVID was having people wait in their cars until it was exactly their appointment time. So maybe that could be another option for people to not have to stay in the waiting room. Any other ideas? One thing I know you guys all are really good at, because you've been in Chatter, is adapting your communication style. So you guys already kind of have an upper hand there where you know how to adapt your communication style to create a good back and forth. Appointment follow-up reminders, that's a huge one, and relatively easy to do. And so they're not really costly accommodations. They're nothing that is going to be out of what's possible or what's realistic. So yeah, you guys have pretty much the right idea, the generals. So one really obvious solution that I'll direct you to if you want is there is this toolkit called the Aspire Toolkit, and I'm going to send you guys the link to it in an email after the presentation. So this is a really comprehensive toolkit that was developed to address this area of healthcare barriers and increase the experience, the positive experience for autistic patients. So there's one for the patients to learn about their own healthcare need, and there's one for providers. And it's free, it's online. And you can see tons and tons of suggestions for how to kind of mitigate these barriers. So communication, it tells about how to determine a patient's preferred mode of communication, maybe having AAC, picture visuals available. It really explains the potential for making false assumptions and the need to assume and presume competence. So that is, maybe if you have a lot of people that maybe have bias and they don't have experience working with autistic patients, maybe if an adult comes in who communicates using AAC, if they have someone who's accompanying them, a lot of physicians will just talk to the person that they came with and won't think to talk directly to the person who's not speaking. It also kind of teaches our physicians who don't know the difference between receptive and expressive language, different communication styles, and how you can adapt your own communication. So using really literal, precise language, closed-ended questions. A good thing you can have is a list of symptoms and have them choose which symptoms to have instead of having them be the one to generate their list of symptoms. It kind of tells you how to adapt your environment. So if you do have your own clinic, using natural light instead of fluorescent lights, reducing background noise, not unnecessarily touching the patient, and how you can kind of help to understand how body awareness and interoception can influence how someone experiences pain. So you're maybe interpreting a report of how significant pain is, so you're taking it a little bit differently than you would with your neurotypical patients, and not saying someone has kind of a bunch of features of a certain disease or disorder, but they say, but I don't have any pain, that you don't just kind of discount that disorder because they're not feeling the pain that a neurotypical person might feel. One thing that we didn't talk about for planning an organization is the need for consistency. So maybe your client can have their appointment in the same month at the same time every time. They always get a 9 a.m. appointment or something like that. So it's something that's expected. Kind of narrating what you're doing, letting patients know what to expect. So giving them that blood pressure cuff to hold first, see what it feels like, explaining it's going to get tight, but it's not going to hurt. It only lasts 30 seconds long. And so they really know what to expect. And then also provides ways to support visual thinking. And then it also gives suggestions for how to adapt specific physical exams. So, like I said, showing them equipment beforehand, letting them tell you, I need a break, I'm going to come back to this. Maybe kind of deciding which invasive physical procedures are really, really necessary, and maybe are there other options in some cases. And then there's some suggestions for accommodations with the bottom, because that's particularly difficult for lots of autistic people. So that's for you guys who are going to be awesome doctors. Now for all the SLPs, what are you going to do? First of all, advocacy is a huge role of being any healthcare professional, but we have to go out there and advocate for people to understand these differences and understand how communication impacts participation in different aspects of adult life. It's totally within your scope to train healthcare providers on communication strategies. So for example, if you're an SLP and you have a teenage client who is maybe worried about going to the doctors, you could write a letter that they could give to their physician, explaining how you can accommodate and explaining their communication style. If you work in a hospital setting, you can talk to your colleagues and give them suggestions on how they can communicate with their clients better. And then we can also teach self-advocacy goals to our clients, and it doesn't have to be specific to healthcare, but any age, any means of communication, whether you're working on AAC or you're working on social skills, you can always be building in self-advocacy goals for your clients. So that is healthcare. So we're going to get into questions at the end after Neha talks. Are there any specific questions about the healthcare stuff before I let Neha present about the workplace? Yeah.
It's probably maybe a silly question, totally out of ignorance, but how is the information of a client having autism spectrum disorder provided to healthcare professionals so that they know how to make these preparations for those clients appropriately?
That I don't know exactly. I assume for some people it would be in their file, but a lot of autistic adults will kind of tell someone that they have autism. So it could also be up to the patient to just disclose it to you. And then it's also important for anyone working in healthcare to know the characteristics, because maybe you're going to see it before they do. Maybe you're going to notice that they're autistic before they're being assessed. And so there's lots of kind of checklists out there that you can access to kind of look for what the characteristics of autism can be. And you'll see that once you've been in chatter for a little while, you'll just know, like you'll just get this sense, because autism presents in so many different ways, and we're so lucky to work with so many kids and teens that are really different from each other, and we get to see such a wide range of the spectrum that you'll get pretty good at spotting it. Questions?
Thank you.
No problem. All right, so we'll have time for more questions just overall at the end, and I'm going to let Neha jump in.
Sorry, I was muted. All right, it's so nice being able to see everyone, because we always have to have our masks on, but I'm going to share my screen and we'll start presentation. Okay, so I'm going to be talking a little bit about employment and autism. So just before I start, I wanted to share this with you because this is where I took my information from. So there's a course offered by the University of British Columbia online. It's completely free, and so anyone can take it. So I encourage all of you, I'll send you the link after this workshop's done, but basically it's a self-paced online course, and it teaches you a lot about autism in the workplace, hiring and inclusivity, and even just inclusive leadership. So I think that even if you're not an employee or an employer yet, all of you are amazing. So I know you're going to do amazing things in the future, or for sure you're going to have coworkers or situations, even if you're still in high school. I know some of you are in high school, you can apply some of what you learn into maybe how you approach group projects, or maybe how you approach collaborating with people, because as you've probably seen at Chatter, for a lot of the children who come, you may not even know that they have a diagnosis. And so that extends far into high school and university as well, where if you're collaborating with peers, you may not even know, maybe that they're on the spectrum or they have autism. So just something that I really, really enjoyed. And I'm going to be taking some video clips from here as well to show you guys. All right. So the first thing that I wanted to talk about, just briefly go over, is the common social communication challenges that people on the autism spectrum have. Not all of them may have this, but you may also notice that this is common for the kids at Chatter that you work with. So one of them is interpreting nonverbal communication. So that might be rolling your eyes, raising an eyebrow, things like that. And it's something that, if you're working in a group project or on a Zoom meeting or things like that, for people like you and I, will be able to pick up on that right away. But someone with an autism diagnosis may not be able to. And that also plays into the role of understanding sarcasm, which is the next point. So if you're cracking a joke, let's say at a meeting or things like that, and someone's not laughing, your first instinct might be to think, oh, well, they're being cold, or why don't they like me? But you may want to challenge yourself to break that stereotypical pattern of thinking, because the person who's not laughing may just genuinely not know that you're cracking a joke or it's sarcasm, right? So that's just one thing to be mindful of. Another thing is difficulties with changing your voice or pitch and volume to match the situation. So someone with autism, for example, when they're really sad, they might still be talking in a happy tone of voice. There's things like that have happened at Chatter as well, which I'm sure some of you have experienced. Or let's say even if they're happy, they might be talking in an angry tone. So that's one thing. And sometimes in the workplace, that can be interpreted negatively, of course, and have consequences. Yeah, consequences for that. Another one is engaging in small talk or social conversations. So that's like, if you're by the coffee machine and you are talking to your coworker about the weather, things like that. People with autism may not know how to start those conversations. And of course, at Chatter, we have our whole lesson about how to, like, the steps of a conversation, how to go through a conversation. So you can see that is really setting them up for success in the future when they go off into the workplace, into university and high school. And the last one is, of course, perspective taking, that we have gone over at Chatter a lot. So that might be, let's say in the workplace, an example could be if they walk into their boss's office and they see that their boss is really stressed and talking on the phone, but they have a question, they might not be able to take the perspective of their employer or boss and think, hey, this might not be a great time for me to ask this question. Let me just maybe grab a coffee or go to the bathroom and come back and maybe ask that question after they're off the phone. So that might be, and if an employer, employers could get frustrated if things like that happen and they're not really aware of why it's happening. Like, they might think, oh, this person's rude, they're interrupting me while I'm on the phone, and they should know better. But if you have autism, you don't know better, because that's something that you're not able to take that perspective about it. Okay, so I wanted to show you a video. I'm really excited about this. The video is from the course that I've been taking, and all the videos that you'll see are individuals on the spectrum talking about their own experiences. So I just want to share this with you. Okay.
I like it. Social interactions are very, very draining. And I know talking to people is part of having a customer service job, but doing the same thing socially over and over and over again constantly in the time span of like several hours, and there's really only one short break, it's very, very taxing on us, and that can change our emotional state and sometimes cause us to have a bit of like a flatter, less happy, joyful tone. So then customers interpret it as you're being rude or you're not being super respectful of them, and then sometimes you get in trouble. So I wish employers would be more mindful of that. Also, just in terms of being around other people, like sometimes we're not really super like upbeat and smiley all the time. And it doesn't necessarily mean we don't like the person we're talking to, or we're not trying to be nice or respectful. It's just, I don't really hear myself when I talk sometimes. My tone can be very flat and people interpret that as something else. But it's not necessarily I'm trying to be rude.
Can I share my screen again for the presentation? Okay, so that was just an example of what we talked about, things that people that can get misinterpreted. All right, the next point I wanted to talk about was sensory filtering. So for neurotypical people, our brains automatically filter out sensations that we don't want to pay attention to, and they automatically know what we are paying attention to. So when you're having a conversation with your friends at a noisy restaurant, you're able to focus on what they're saying in their voice, and you're able to tune out the background noises of the dishes clanking or other conversations. And for example, you might be able to sometimes zoom in and out of what the one person's saying, because you might overhear a conversation and you're able to kind of switch your focus there. But imagine that happening every single time when you're talking. So let's say if I'm talking to Annika, but all I keep hearing is someone else's voice, it can get really frustrating. And so that's why sensory filtering is something that a lot of people with autism struggle with in social environments. And so some of them might be overstimulated, and we call that hypersensitive, by the different types of sensory input, where other people, other individuals with autism might be unaware or hyposensitive. So they might not, so like an example is they might not show any reaction to an extremely loud noise, but they might be really, really distracted by the low humming of a fan. Or sometimes that chatter, you might notice that the kids that you worked with are completely distracted by like a small speck of dust, and they're not able to focus on what Kathy and Annika are drawing on the whiteboard. So that's an example of sensory filtering difficulties. And so these were some quotes that were taken from the course by some people, individuals with autism. So it's not that we have difficulties with our senses, it is that it requires constant work and attention to try filtering out what we don't need to see, hear, smell, or pay attention to. And this person it's really long, so I won't read all of it, but they're just saying they might have different sensitivities. So if someone is wearing a very strong perfume, that perfume could interfere with their ability to focus on the meeting that's happening. They might get completely lost or disoriented. So I wanted to show another quick video about someone talking about this experience. Sorry, just give me a second here.
The entire time, it's pretty fantastic. One of the ways that I experience sensory input is that in certain music situations, I get flashes of light that come along with notes.
So for example, D minor is sort of a gray color. I get flashes of orange for C major. When I use certain words, I get a feeling in my mouth, but that's not all of the time. But I do have ears that I think are a little bit weird, because it seems like I end up processing all sound coming in to the same volume level. So if I'm in a situation where it's a whole bunch of background noise and I need to concentrate on one person, then I end up trying to stim, because that helps me concentrate on that one sound note, sound phrase, rather than the background noise.
Sensory things, just like anybody else. If you're stressed out, you're tired, you're more sensitive to noise and everything. And so because my senses are already heightened with noise and stuff, I like to stick to places that make me feel comfortable and make me happy, because then that makes those things easier to deal with.
All right, okay. Now we're going to go over some statistics about autism and employment. So the reasons that individuals with autism are unemployed or underemployed have little to do with their ability, but more to do with the barriers they face, or the stereotypes and stigma that they also face. So 85% of autistic individuals are unemployed or underemployed. And of those who are employed, 54% report that they would like to be working more hours. And then on this side, we have the stats, which is really sad, but 51% of autistic employees report unfair treatment on the job. They face barriers in the recruitment process. So for example, similar to what Annika was saying for the healthcare portion of when they're asked questions about on a scale of 1 to 10, rate your pain. Similarly, on job applications, there might be unclear questions that might say for like rate your communication skills, things like that, or unclear questions in their interviews. So sometimes the onboarding processes for many organizations is more of a test of their social ability rather than the skills that they need for the job. So like you can even think about it, for example, when, let's say if you're an engineer and you have a job interview and they're asking questions, most of the questions are centered around why do you want this job? Things that are more social questions, like they might ask a few technical questions, but a lot of it is centered on your social ability and your communication skills. So things like if you don't make eye contact with the hiring manager, they might interpret that as you being unconfident or rude. Or things like, let's say if they also try to crack a joke to lighten the tension when the interview starts and the other person doesn't laugh or smile, the hiring manager might think, oh, this person's really rude. They don't think I'm funny. They're not laughing at my jokes. So things like that are barriers right from the recruitment process, and not to mention when you're actually in the workplace. And 60% of employers report not knowing where to go to provide the right support for autistic employees. And so the common accommodation requests that the average employee requests are flexible work and location hours. So the ability to work from home, to drop off their kids and at school or daycare. And we're talking about right now neurotypical employees, so employees who would not have autism. They also request extended breaks, so the ability to go home to care for their parents or maybe pick up their kids for lunch. And then a modified workspace. So a lot of people request ergonomic chairs or ergonomic desks, or some people might have arthritis. They might request workplace accommodations. And so there's a stat that's coming up. It's going to come up, but I wanted to share it now here, and we'll talk more about it after. But there was a study that was done where it revealed that 95% of the workplace accommodation requests actually come from people who do not have any disabilities. So 95% of workplace accommodation requests come from neurotypical individuals. And so I really wanted to share that, and we'll talk more about that, but that that might be surprising. And if it's surprising to you, because it was for me, I think it just goes to show how much stigma there is about accommodations and what individuals with disabilities actually require in the workplace, because it's actually not that much and they're not asking for a lot. So we're going to delve into that, but I wanted you to just think about that as we go along. So here are some benefits of hiring employees on the spectrum. So they are qualified. 50% of autistic people who enter post-secondary get a degree, and a third of people who have autism attend college. And so they're also reliable. 86% of autistic employees were rated by their employers as average or better on attendance than their neurotypical colleagues. They also meet and can exceed performance standards. So 90% of them were rated as average or better on job performance than their neurotypical coworkers. And they're also really loyal. So their turnover rate is as low as 7%, and their retention rate is 72%. And just for some context, in 2020, the average turnover rate in Canada was 56%. So you can see that that 7% is a lot better than what the national average is. So I wanted to show you another quick video. Okay. Oh, sorry.
To me, what it means to be working is, obviously having the income to live with my boyfriend, just get groceries, basic stuff is the main big thing. To me, work is a place where you get things done, and where money is an important thing for you to get to live. But I mean, there are some times where you can make nice friends with your coworkers and stuff.
I guess it just gives me a sense of independence and proof that I'm growing as a person and becoming more adult.
Work helps me feel good and confident, and having a job, it keeps me productive and eligible as part of the economy.
For me, working is, I would say, it's primarily about kind of having a sense of purpose. Like for me, like every job that I've done, like I've always been like, the person who would jump into and give 110, 120%. So it's, in a way, it's often like a sense of identity that you can kind of get from work. Obviously, the money's kind of like, it's nice to get some money and not be reliant on everyone. And the other thing is also it's an opportunity to kind of meet other people as well. And you never know who you might meet or what you can learn from them.
Besides working, I want to get along with my coworkers, like get along with my hostess, my bartender, maybe secretaries or doorman too. So that, I wanted to get to interact with others.
For me, to be working, it means participation in society. So if you're at home not working, even though you can, it sort of gets an idea that, oh, I'm not a part of society. So I like being, of course, I like being financially independent, but it gives me a sense of I'm participating in society. It's the same thing with elections. So if you're able to vote, please vote. If you're able to do things in society that no one else can do, such as activism, please do so, because it's when you participate, when more people participate in society, the society grows and flourishes.
It means that my wife can get me out of the house. It means that I can, that she doesn't have to be concerned about me, and she can, and working means I can bring in paychecks that help support our family and my child and keep us solvent.
It's so hard. It was so hard for me to just pick a couple videos because they're all so amazing. I spent so much time just watching all of them. Okay. Next one. And yeah, this was what I was talking about before, that a 2014 study that was published found that 95% of accommodation requests in the workplace come from people without disabilities. And then based on a 2019 study, 57% of accommodations that were made by people with disabilities cost nothing at all. So like I was saying, we really want to deconstruct that stereotype that hiring individuals with disabilities is going to cost you a lot. If anything, it's going to cost you a lot to not hire them because, like we said, there's so many benefits. And 37% of employers incurred maybe a one-time cost of less than $500. But like I said before, that is such an investment because if this employee is going to work for you for the next 20 years, that's such a small cost for all the amazing things that they're going to do for your company. And so this was a quote that I really liked. To look at accommodations not as special treatment, but as a best practice beneficial to everyone. So a lot of the times, oops, sorry, I'm gonna go back. A lot of the times when there's accommodations in workplaces made for individuals with disabilities, everyone benefits. So for example, ergonomic pencil grips were actually developed for individuals who've had disabilities. And now everyone has, I can't find an example, but like that, fluffy thing on your pencil that you hold to make sure that your fingers don't hurt. That was developed for individuals who have disabilities in the workplace, and everyone benefits.
Another one is texting. Texting was developed for deaf people who couldn't talk on the phone, and now we much prefer to text than talk on the phone.
Exactly. And this one, I want to talk about inclusive work environment practices. So 170 autistic employees across Canada, they were asked about their work experience, and they talked about these three main things that people could do or workplaces could do to make their environment inclusive. So one of them was educating coworkers about inclusive practices and acceptance of different people with autism. So I think similar to the presentation that you're listening into today, just breaking down stereotypes, debunking myths that are out there will really help create inclusive environments. The second one was having supportive management and or a mentor to ask questions to. So similar to what someone suggested during the healthcare portion was if someone doesn't understand directions or something in one way, maybe you can try another way. So maybe instead of verbally asking your coworker to help you with something, you can write it down on a sticky note, and when they see that, they'll remember it and they'll be able to check it off. And the third one was clearly communicating expectations and providing communication accommodations when needed. So like I mentioned, these accommodations are often nothing huge. What something could be, instead of attending a meeting online, they might prefer to maybe even go to their employer and meet them in person to have that meeting. It could be maybe having subtitles when there's videos playing, just small things like that, that really go the extra mile. And I think this is the last video that I have. So let me share my screen. Sorry, just give me 1 second. But yeah, if you have any questions right now, it would be a great time to pop them into the chat.
when I'm having trouble understanding whether you are being sarcastic or not, I'm not trying to mess with you. I'm not trying to be philosophical or whatnot. That's just how my brain functions.
When I start a new job, I'm always shy at first, and I'm always have a hard time, trying to elaborate things with my own words. When I get used with it, I'm not really shy anymore.
What helps me learn best is learning through experience. So actually, I should rephrase that, learning by doing.
What helps me the most when it comes to learning a new task is watching a demonstration and then practicing it myself. If a demonstration isn't available, detailed instructions would also help a great deal.
In order to learn how to do a new task, I found that written instructions are usually a lot better than spoken instructions. Also, practicing it, doing it lots of times, I need to actually try and do it myself in order to get it. Also, if someone shows me physically what I need to do, and then it's okay, now you try it, and then I can try and do it the exact same way, that's usually very helpful.
When I'm starting a new job, what I usually prefer would be a mixed module of learning. For me, I really like situations where, especially if you're being brought on in a cohort group and you get to basically learn together in a classroom setting. Because for me, I find that I'm kind of a bit of a shy person sometimes, and I may not necessarily ask too many questions. But I really appreciate hearing what other colleagues had to ask and basically getting insight from those. And sometimes, even though I might not have a question initially, but I might end up having a follow-up question or add-on question to something that someone else may ask. And once we're beyond any initial training that may be given, I really appreciate getting the chance to basically to job shadow colleagues, basically see how they do the job. And then before I actually do it myself is to basically have, someone watch me do the job to make sure that, I'm not doing anything that's, blatantly wrong or I'm missing out on something.
Okay, so that's the end of my part as well for the presentation. Let me see if there's any questions. Oh yeah, perfect, Annika, thanks. Copies of the presentation. Yeah, so we'll email the recording out to all of you, so you'll have access to the full presentation that we have today.
And so if anyone has any questions, you can put them in the chat. I'm just going to answer quickly the questions that people put into the Google form that we filled out. So someone had a question that said, what are some tips or methods to make the workplace or any environment more friendly and helpful? So I think Neha did a great job of answering that already. But I like this question of, would special treatment be more beneficial or harmful? And so the answer is the right accommodations are helpful and actually necessary for an environment to be inclusive. And they're really about leveling the playing field. So this is kind of a nice visual of, it's not about putting someone above and giving them a special treatment, it's about getting them to the same place. But where could the harm be done is if you make assumptions about what they need and you don't presume the competence in something. So easy way to avoid that is just ask them or let them know, let them tell you what they need, and you'll individualize your accommodations to them. Another question we had was, how can we help children that have trouble speaking fluently? So I wasn't sure exactly what this person was asking, if they were talking about just with autistic people, helping them kind of communicate well, or if they were actually talking about stuttering. So I interpreted that they were talking about autistic people, but if that was you and I answered your question wrong, just let me know. So for autistic people, some nice general communication strategies are to give them 5 to 10 seconds of wait time after you ask the question. So that leaves room for them to process and kind of with their answer. So let them have a time to make a comment. Don't feel the need to fill silences because they might be kind of processing what you're saying. Another big thing to do is avoid asking double questions. So a lot of us do this when we're talking to kids that maybe have difficulty language is that we ask them a question and then we ask them a question right after. So we say, what did you guys do this weekend? Did you go outside? Well, then you ask them 2 questions and now they have 2 things to process instead of what did you guys do this weekend? So you've made it harder. So anytime you talk to someone that maybe has some language processing difficulty, think about only asking 1 question at a time, and you'll be surprised at how many times you ask 2 questions at once. Just use a slightly slow but still natural rate of speech. So I like the rate of speech. So I like the word unhurried. It's not like robot-like, but you don't need to tell them to slow down. And then just listen to what they have to say and not how to say it. So if someone is having a little bit of a hard time coming up with the right word, if they're making grammatical errors, just don't worry about it. Just listen to the content, and that is good advice for anyone. Don't worry too much about if people are perfectly eloquent or if they're using exactly the most academic terms. If you can get the message, then they communicate well. Another person had a question about the difference between healthcare in community versus acute care settings. So I thought this was a really interesting question. I don't know of any research that has addressed it, but I think that an acute care setting would exacerbate the sensory and the communication barriers due to the environment. So think of an emergency room versus a small clinic waiting room. And then also the physician who's maybe working in the emergency room isn't going to have as much time to get to know each patient and get to know how to communicate with them, what accommodations work for them, say their ongoing acute input. So I would guess probably the acute setting is more difficult, but I'm not sure. So that'd be interesting to find out more about. And then someone else had kind of said if the ASD was not well integrated into the curriculum, any programs or learning opportunities to increase this knowledge for healthcare professionals. So this is not specific to autism, but it is great for anyone with a communication disorder. It's a free course called Supported Conversation for Adults with Aphasia. So aphasia is a language disorder that an adult would get from having a brain injury or stroke. But this course is awesome. So it's great if you're going to work in a hospital, you're going to meet someone with aphasia because it's really common too. But you can apply a lot of their strategies to a lot of different types of communication disorders. So if you're in medicine working in a hospital setting, encourage your colleagues to take this free course. You can use the Aspire toolkit, which I'll share with you guys, and I'll also share the link to the supported conversation with you guys after. One of the best sources you can learn from is just social media accounts run by autistic adults and podcasts and blogs, because scientific peer-reviewed research has historically excluded actually autistic voices. And if you really want to listen to the true experts, you might find better information on Instagram than you would in a peer-reviewed journal. So these are some examples of some accounts that you can follow, but there's tons out there. That's what I learned a lot from. It's just from social media. You can also learn from the Autistic Self-Advocacy Network, which is a website that I'll share with you. And then things like chatter and just interacting with autistic people. So research has really found that one of the best things a neurotypical person can do to interact positively with autistic people is just to have experience working and talking with autistic people. So you guys are on the right path, and you can always feel free to email us specific questions even after you're no longer here at Chatter, because we're happy to help. And then I just have to put this to the end because you guys, if you're going to be going into pediatrics, one of the best things you can do is just not wait and see. So many people do this. I don't know why. Parents say, my child isn't meeting their milestones, I'm really concerned. And their pediatrician says, just give it some time, they'll grow out of it. But I don't know why they do that, because early intervention is so important. And also it's such a minimally invasive thing to get a PT, OT, or SLP assessment. So the worst that can happen is that the clinician will just say, that wasn't necessary, thanks for referring them anyways, it was good to check. So I think sometimes maybe it's that if you're a doctor and you're maybe worried about for like referring someone for a CAT scan or something is much more expensive. It's a much more invasive procedure. So that's where you want to kind of not over refer. But referring to PT, OT, SLP is just always better. There's minimal harm in over referring and potentially lifelong impacts from under referring and having kids miss out on early intervention. So that is one thing you can do if you're going into pediatrics, is just refer your clients. If you, a parent, if anyone has concerns about development, just find out. There's no reason to just wait and see the development. Yeah. All right. Well, it was so fun to talk to you guys. I see there's another question in the chat. Oh, yes. Follow us on Instagram. Check out our new website. We have a beautiful new website that's got a lot of information. And we're going to be posting a bunch of information about autism. For those